In this enlightening episode of Your Health, Your Wealth, I, Dr. Eddie Patton Jr., had the privilege of sitting down with Hal Katz, a partner with the Hush Blackwell law firm in Austin, Texas. Our conversation delved into the intricate world of healthcare business and regulation, shedding a light on topics that affect individual health and wealth and prosperity when it comes to your healthcare. We began by exploring the concept of the corporate practice of medicine. Hal explained that this refers to the state of laws and regulations designed to ensure that the medical decisions remain in the hands of the physicians. He highlighted Texas as an example, noting its strict prohibitions on how non-physicians can structure relationships with doctors.
Corporate practice of medicine means the various state laws and regulations that are designed to ensure that doctors are the ones making medical decisions. It is the law that prohibits non-physicians, be it an individual who's a non-physician or a corporation, from owning a medical practice and getting involved in the clinical decision making. It's a long-standing doctrine in Texas and across the country. It varies by states, but in Texas we have one of the strictest prohibitions on the corporate practice of medicine. And that prohibition really limits how non-physicians can structure relationships with physicians, be it physicians who decide they want to bring on a management company to manage their existing practice, or when a physician decides they want to sell to private equity or even to a hospital for that matter. It will limit who owns that practice when they sell. That professional association in Texas is mostly what physicians use. Maybe it's a professional limited liability company or a professional limited liability partnership is that legal entity. So when you go to sell, they cannot own that entity. It will still need to be physician owned. However, the physician will turn over all operational and management responsibilities to that buyer, that management company, to do exactly what you just mentioned, to perform those administrative responsibilities that for many physicians have made it really challenging to be both a great doctor and have a great practice, a profitable practice. With all the pressures that physicians are experiencing today, it's really tough trying to be all of that at the same time.
As our discussion progressed, we turned our attention to the increasing role of private equity in healthcare. Hal's insights were particularly fascinating here. He outlined several factors driving this trend: the recession-proof nature of healthcare, the growing demands on the aging population, advancements in medical technology, and the opportunity for consolidation in a fragmented market. It became clear that private equity's interest in healthcare is more than just a passing trend. It's fundamentally reshaping the entire industry.
Private equity really is just investors. They want to make money, and they see the healthcare industry as being a great place to invest because we will always need healthcare. We are only going to need more healthcare as our population continues to age and require all different levels of healthcare. We have standards of care that are improving. We're coming out with new drugs, new treatments, things that weren't available that will be available, and those things are going to be profitable. So they understand that healthcare, for all of those reasons, is, for the most part, recession-proof. They also see healthcare, especially on the physician side, as still being very fragmented. That means they can go out and aggregate physician practices, find these 5 physicians in this one group with these 2 physicians in another group, maybe a single physician in another part of town, and maybe a few others like that, pull them together and very quickly have a 20 or 30 physician group. And together they can invest in an infrastructure, a business infrastructure that supports all the administrative responsibilities. They can invest in technology that makes it more efficient. It will create a better patient experience. For a small physician practice that's still using paper intake forms, they will quickly see pads. It becomes a much better patient experience. There might be an upgrade, a build out to the space. It might be a space that hasn't been upgraded since the 90s that gets a nice, fresh, modern look. So the private equity knows that when they do that, it's going to attract more patients. It's also going to be able to be more successful when contracting with payers on behalf of 30 physicians than it is for one physician to contract on behalf of themselves, or 5 physicians to contract on behalf of themselves for better payer agreements. And group purchasing power, what they pay vendors, suppliers for the products that are needed to support the practice will be at a much better rate than what those individual practices will do. And then the private equity investor has a strategy. They're going to do that aggregation in a state or in a geographic area, and over time, call it 5 to 7 or so years, they will sell that platform, that private equity platform, either to another larger private equity buyer or maybe even to a strategic buyer like a health insurance company or even a health system that is looking for a physician practice to align nicely with the other services that they're trying to offer their members, be it their patients or other customers.
One of the most intriguing parts of our conversation was Hal's overview of how healthcare has evolved over the past 3 decades. He painted a vivid picture of the industry's journey from the rise of the HMO in the 1990s to the implementation of crucial regulation like the Stark Law and HIPAA in the early 2000s. Hal then described the Post-Affordable Care Act era, which saw increased alignment between physicians and hospitals before bringing us to the current phase dominated by private equity. His historical perspective provided valuable context for understanding the forces that play in today's healthcare landscape.
Before we look at that crystal ball, let's talk about the last 30 years. When you look back, it makes sense of how we got where we are today. I'd say it started in the 90s when we had HMOs and managed care becoming major players. HMOs implemented the gatekeeper model, and patients were really frustrated because they didn't have access to their doctor, and there was a lot of push and pull on that model between, again, HMOs and managed care. Then I'd say in around the early 2000s, we saw the Stark Law and the HIPAA law really come into full force, imposing a lot of regulatory requirements on physician practices and a lot of consequences on physicians for failing to comply with those regulatory requirements. That resulted in investment in technology, investment in legal costs and compliance officers. And so that put a lot of pressure on the physician practice. We then had the passage of ACA, which resulted in physicians again realizing that they weren't in the best position being on their own and started to align themselves with hospitals. So we saw a lot of hospital acquisition of physician practices or just straight up employment of physician practices. And then we're in our current phase, the private equity phase, where we're seeing private equity as a major player in healthcare. And in some ways, I'd say it could be helpful because otherwise we would see just the hospital systems out there buying up doctor practices or directly employing practices, the insurance company, the HMOs, the Humanas, the Aetnas of the world, the United, buying up physician practices, employing physician practices. The private equity investors see this as an opportunity, and so now they're aggregating physicians. So as far as where I see things, back to that crystal ball, I do think that we're going to see continued consolidation for a while. I think it will likely it has the potential to help physicians consolidate, again, create a better patient experience for patients. You also have to keep in mind that doctors coming out of residency into private practice, there aren't that many that really are interested in going into private practice, not employed by a hospital or someone else. Those who are really entrepreneurial, want to work hard, I would say that mindset is less common at the moment. So I see private equity continuing to consolidate, but I don't think that we are looking at where we're likely going to be in 5 or 10 years. I do think we will have some private equity companies that go bankrupt. We'll see the Federal Trade Commission crack down on some of the private equity platforms, maybe even some of the strategic, call it hospital systems or insurance companies that have acquired a lot of physician practices, break them up. And so I think we're going to bounce around for a little while. In 10 years, I mean, my prediction is that healthcare will likely look very different, from virtual health to digital health to artificial intelligence, AI, the role that all of those things play. I'm optimistic that will result in better access, better quality, better transparency, more competition, because everybody's going to have access to better tools that will allow them to do what they need to do better.
As we look to the future, Hal's predictions were both exciting and sobering. He foresees continued consolidation in the short term, but also warns of potential bankruptcies and increased scrutiny from the Federal Trade Commission. However, it's not all caution. Hal also anticipates significant positive changes driven by virtual health, digital innovations, and artificial intelligence. These advancements, he believes, could lead to improved access, quality, and transparency in healthcare delivery. Throughout our conversation, I was struck by the complexity of the healthcare system and the myriad factors influencing its evolution. Hal's expertise brought clarity to these intricate topics, helping our listeners understand the forces shaping the future of medical practice and patient care. As we concluded our discussion, I couldn't help but reflect on the importance of staying informed about these trends. Whether we're healthcare professionals, patients, or simply concerned citizens, understanding the business side of medicine is crucial for navigating our own personal health journeys and making informed decisions about our care. Thank you so much for listening to this episode of Your Health, Your Wealth. Please consider sharing this episode with your friends and family, and subscribe to the show wherever you get your podcasts. To learn more about my practice and schedule an appointment, go to eddiepattonmd.com.